Hello, and welcome to Humanities Matter, brought to you by Brill. I'm Lee Chung Greco, and this week we'll be looking at key issues in the field of humanities. We're talking with Dr. Obinna Ifediora today. His paper is West Africa's Ebola Pandemic Toward Effective Multilateral Responses to Health Crises. So this is a very timely paper right now, given the current coronavirus pandemic. The West Africa Health Organization's strategic plan had anticipated a regional health crisis and highlighted the inadequate sub-regional database. Can you just explain the state of those databases before Ebola and how they hampered cooperation?
It's at the sub-regional level within the West Africa, there are policies in place, well-defined, well-structured policies. However, those policies hasn't been translated into tangible capacities, which makes it difficult to react to emerging situations. At the time when Ebola emerged, the capacities mentioned in the strategic plan weren't in place. Both the database, both the testing labs, even human capacity, West African Health Organization lacked those resources. In fact, that was the reason why it was not detected early enough, although they knew there was an outbreak of something, but they couldn't identify what it was because those resources that should have enabled them to identify and then pass the message on to the WHO weren't there. So it took a long time, over 3 months, for them to realize that this is actually Ebola. So the lack of capacity at the time, prior to the Ebola outbreak, there was no adequate resources to help West Africa Health Organization to actually understand what was happening. So it was in a poor state.
So many of these lessons seem like they can be applied to our current pandemic. So can you talk about what lessons you can apply to coronavirus from the Ebola outbreak, particularly when it comes to regional work and early warning?
That's a very significant question. After Ebola, what we identified and what has happened so far has been the establishment of additional capacities and institutions within the African continent. Now we have Africa Centers for Disease and Control. The center has subunits within the 5 sub-regional groupings in Africa. What these institutions do is what West Africa Health Organization strategic plan actually mentioned. So they now do better surveillance, they do better monitoring, they do better data collection. The database is there, but it's not as functional as it should. So in the context of early warning, now we have capacities to actually respond better. From what I've seen after Ebola, I don't think there will be any outbreak in Africa, anywhere in Africa again, that will take more than 2 weeks to identify and respond to. So that's a key. That's a very important. COVID-19 didn't start in Africa, obviously, but because of these institutions we now have in place, we're able to develop a plan before it arrived on the continent. So it helped these institutions helped to identify what's necessary, what capacities we need, kind of response capacities that we need to put in place. Beds were built even before COVID-19 arrived on the continent. Additional training were provided, through the WHO and the US Centers for Disease Control and Prevention as well. So early warning, it's now in place. Unlike what happened, in Wuhan, where the COVID-19 began, because there is obviously depending on. I'm not studying Asia institutions, but I can tell you that the time lapse between the time it was discovered, which, as the news say, is whether it's sometime within late November to early December when they first noticed the virus, until the time it was reported, which was sometime in January. So we lost about 4 to 5 weeks there. And these are the kind of things early warning regional organizations can help, in making sure that, we have adequate information. It was left for Chinese government to identify what's the disease and then communicate to the entire world. Whereas regional institutions work better because it's not just about the states working. China obviously is a very large country as it is, but regional organizations work better in the sense that there is much more transparency within these organizations.
Dr. Ifediora, thank you again for coming on today and talking with us. Really appreciate it. His paper is West Africa's Ebola Pandemic toward Effective Multilateral Responses to Health Crises. Well, thank you again for speaking with us.
Thank you so much for having us. I'm very grateful.
You are listening to the Humanities Matter podcast. You can find more podcast episodes on Apple Podcast, Spotify, and Google Podcast.